Hello, welcome to this TED Talk titled Reducing Fear Through Exposure. For this TED Talk, I'm going to use the example of water birth. First, I'm going to how many of you have seen a water birth, desired a water birth, thought about attending a water birth, and did you even know that water birth was an option? Like a lot of you, when I came to University of Utah, I didn't know much about water birth. I was a midwife and I was attending births, but I wasn't attending water births at that point in time. Since we had an ongoing study, I did all of the training and said, sign me up. So I watched the video like I was supposed to do. I went to a couple of water births with a midwife, and then I was on my own. As I started attending water births, I noticed a few things. I noticed kind of like pros and cons to attending these water births. So first off, the patients were ecstatic. They really loved it. They loved the choice and the autonomy to birth in the water if they wanted. And they used less pain control. They were having natural birth without epidurals, and they felt really supported by just being in the water. And some cons. I noticed I was wet. Turns out attending water birth is a really wet process. The nurse was wet. The room was wet. There was a lot of unease about, is it safe? Should I leave her in there? Should I get her out? Our OB attendings, many of them had never seen a water birth. They would come in and help us if needed. If we ever needed help, we often got the woman out of the tub. They were curious and excited, but a little bit uneasy about this alternate birthing position. Historically, water birth has mostly been out of the hospital, but I told you we had a study here at U of U, and we were studying prospective data on women who birth in the water in an academic medical center. So were the outcomes safe for mom? Were they safe for baby? Was it feasible overall? Oftentimes in going to meetings, we would hear feedback from pediatricians like, is this safe? Do we know it's safe? My reply was, we're studying it. What we know from the literature is that birth outcomes for people who birth in the water are very similar to birth outcomes for people who birth outside of the water. And we're going to continue collecting data, and we'll let you know how it's going. So kind of the pros, patients really liked it. It was really exciting for them. The cons, it was really wet. There was a lot of unease around it. And it was oftentimes hard to see the baby being born. Fast forward a little bit. It turns out that they needed someone to be the principal investigator for the water birth study. The lady who was doing it was promoted, and so she went somewhere else, as we often do in academia. So they asked me to be the principal investigator. I was like, yes, I'll be the PI. I'm excited about this. We're giving a choice to women. We're birthing in the water. We're providing a service that's not widely provided. Right now, U of U is the only hospital in northern Utah providing water birth or offering water birth as a choice for women. I was really excited. I was like, sign me up. We can do this. We can continue this study and continue gathering these outcomes for women. Well, it turns out our study went on a little bit longer than we thought due to maybe some lower enrollment. And as you begin managing a study, especially one with 15 co-Is, you soon see that there's a lot of training that goes on. There's a lot of training records to manage from the city side and then from the clinical side. We onboarded 6 new providers in 1 year, so we had to get them up and going on the study, both with the research side, with city training, and with the clinical side, with attending water births, whether they had done it before or not. And as I was running this study, kind of this ongoing study, I started getting, a lot of questions like, Are we doing the best job at training that we can? Could we train people better? There's a lot of unease from a lot of providers. And so I started thinking about kind of this concept of how can we do this better. Um, and this quote really stuck with me. This quote says, "The future of water birth will depend on the beliefs and experiences of people involved in the birthing process, including midwives, pediatricians, labor and delivery nurses, OBs, hospital admin, and patients." And you start thinking about it, and water birth is kind of complicated. It's complicated to get everyone on board with an alternate birthing situation, especially within the hospital setting. So, going back to the training requests, we are a training program for student nurse midwives, and I had a request to train student nurse midwives. So, I did the logical thing. I went to the literature to see, what does the literature say? How are people being trained? What are their fears? So, in pulling the literature, there was a really great study that kind of stood out for me. In this study, 53 midwives in one geographical area were surveyed, and they talked about their top fears. Some of their fears were maintaining water temperatures, their body mechanics as they knelt by the side of the tub, and then being able to visualize the birth. This lit review also talked about how midwives were trained. 50% of them were exposed by a video or a article. Less than 30% of them were trained in their primary training program. And very few of the midwives who were surveyed had birthed in the water themselves. This really kind of resonated with me because that's kind of how I was trained. I was trained by video. Luckily, I got to attend a few water births with another midwife. I was not trained in my primary program, and I did not birth in the water. So I'm hoping that we can train more of our student midwives in their primary program. But it really made me think about this idea of exposure. Exposure is being given contact to something you otherwise wouldn't have had, making a new view known. Uh, with more exposure to water birth, could we help reduce some of that fear or unease around birthing in the water and birthing in the water in a hospital setting? So next, we're just going to kind of go through some different groups who had identified that they wanted training or needed more exposure to water birth, and some of the interventions that we were able to do for them. So our own midwives, I surveyed them to see where their comfort level was, and it turns out they were comfortable attending water births, but they wanted more simulation training on troubleshooting complications and perhaps on precepting students. Our students' exposure, they need initial training. We're hoping to build a simulation experience where we can train them initially. We talked about some of the kind of the cons of water birth. It's wet, it's harder to attend, harder to see the actual birth. And so hopefully by building a simulation experience, we can troubleshoot ways to talk to the patient and get them to change their position, ways to visualize the birth, and to feel more comfortable with water birth. Another group that kind of came to light as needing additional training was the nurses on the labor and delivery unit. These are licensed professionals who aren't as familiar with water birth, and so they wanted training on how to better support women. I think when you're standing there, it's easy to be like, oh my gosh, I'm getting wet. This is really hard to see. I'm not really sure what to do. And it's much harder to think about kind of that patient side, because hospital-based nurses don't get to see the patients in the outpatient clinic and kind of fill the expectations and wants and needs that the patients have, and the ideas about birth that they have before they come into the hospital. So we created a training, kind of a patient-centered training for the nurses. went to their staff meeting, delivered this, showed them a few beautiful videos of water birth, and afterwards, a few of them said, "Thank you for sharing that. I had never thought about water birth from that point of view." And so that really kind of resounded with me as well. Um, Opportunistically, I teach undergrad nurses, so I feel like it's important to give them exposure, early clinical exposure in their pre licensure program. These are nurses, and we don't really know where they're going to work. And so it's kind of cool to think this ICU nurse might have more education about water birth. And the other thing about pre licensure nurses is they're the nurse leaders of the future. So they could support water birth as hospital administrators or be a voice when sometimes, had they not had the early clinical exposure, perhaps they wouldn't be as aware of water birth itself. Um, I think exposure is important for pediatricians, our OB attendings, and other physicians. I feel like pediatricians sometimes feel like assessment might be delayed with water birth. And so it's especially important for them to know about the changes and the normalcy, so they can get their assessments done as needed. I was also able to present the clinical echo and give some exposure to water birth there. That was a lot of fun. Um, anyway, it's been really great, really fun talking about water birth. I wanted to end with a quote from Ben Franklin. It says, "Tell me and I forget, teach me and I may remember, involve me and I learn." Thanks for being involved today. I hope you learned something, and I hope that fear, exposure, and water birth kind of resound with you. Thanks again. Bye bye.